Good evening, all. I am Priyanka Mathew, lecturer in Department Child Health Nursing, Bharati Vidyapith Deemed University, College of Nursing, Navi Mumbai. Today's podcast topic is Pediatric Asthma Awareness, and we have Dr. Rajalakshmi Not, consultant pediatrician, and welcome, ma'am, for the today's section.
Thank you.
Before starting the topic explanation, I would like to ask you, can you explain about to our viewers about the term, what do you mean by the term asthma?
Good evening, everyone. To explain what asthma in the simplest possible way would be, that is reacting of the airways. It is sensitive and there is inflammation of the air passages which causes narrowing of the passages leading on to the wheezing. That is what we call the asthma in the simplest way to explain to our viewers.
Thank you. And at what age this asthma starts in children?
Yeah, as young 2 to 6 years, sometimes even earlier, we see children who are having what we call as reactive airways. They have a tendency when they have a little cold cough, it goes a little more than a cold cough. Their airways are reacting and they seem to have a wheezing. It is an apparent thing in the beginning because the air passages in children are very small. And so the moment there is any infection, there is automatic sensitivity causing an apparent narrowing there and then the trigger for wheezing. And when it is persisting, we call asthma.
Okay. And can you brief about what are the factors, triggers in asthma?
Simply put, the triggers could be in the environment. The triggers could be the pollutants, the dust mites are there, then pigeon droppings, then the dust in the house, the incense stick we use, even the vapors which come from the all out. All these are some of the triggers from the environment. Organisms, the viruses, they cause a trigger, the viral infection, and then the trigger leads on to the asthma. These are some of the reasons. And one other thing is, simply put, we have something called the gastroesophageal reflux. If a child is having a constipation also, there is a little reflux there. The reflux triggers irritation, and then it causes a trigger there, and it leads to the reactions in the airway passages.
Okay. And how does the seasonal changes like monsoon, winter will affect the children with asthma?
The seasonal changes again is the same, the pollutants and when there is winter, sometimes crowding, sometimes the moisture, the dust, all together. And in a place where we are, for example, like Kharghar, we have the mountains, the breeze comes, and then here, especially in Kharghar, we see a lot of construction, and then we see the pigeons all over. Like in our colony, pigeons are all around. Even the bird droppings, they cause a trigger.
Okay.
Yeah. So, seasonal variation, especially in the colder climates, the rainy season, the triggers are more.
Okay. And can you brief about what are the common cause of or common symptoms of asthma?
See, here is one child who is having a cough and a cold, and it is going away in a few days.
Okay.
Here is a child who is having the same cold and a cough, and it doesn't seem to be going fast. It lingers on. Sometimes there is a nocturnal nighttime cough which is persisting. These are all some tendencies, and the cough doesn't seem to get better. Here also there are gradations. Sometimes it is in response to a viral, and then it lingers on for some time. The child is better until the next episode of a viral trigger or any other environmental trigger, and the child seems to be better in the other times. And some of the children continuously seem to be having these triggers all the time on a daily basis. They go into the next category.
Okay.
where they require little more medication.
Okay. So, can you explain about the managements for
Yeah.
asthma?
The management for the asthma, uh, the simple ones are you just treat the viral
Okay.
infections, and even in my experience, the humidification of the air in the room, in the houses
Okay.
helps. Keeping the child away from the wall
Okay.
and the window, it
Okay.
helps. And giving the medication as per the doctor's prescription.
Okay.
There is a big myth about nebulization.
Okay.
And the nebulization actually is a very good method where minuscules of the medicine goes
Okay.
directly into the lung
Okay.
passages
Mm.
and acts and gives faster results.
Okay.
And for the second category, where I was saying the children require more medication and treatment, for them the inhalers and all are
Okay.
there. There is something called as a preventer medication where we use the inhalation corticosteroids. And the rescue medicine, when they are having lot of wheezing, we give the bronchodilators.
Okay. As you told about the management, what is the role of a parent to take care of a child with the asthma?
The role is simple. We are mindful at home.
Okay.
We do our dusting regularly. We
Hmm.
change the bed sheets. These are the basic things, you know. And as far as possible, having home cooked foods,
Okay.
coloring agents. So
Okay.
many times patients come in the clinic. They say
Okay.
my child was all right. Insisted on having a this cool drink,
Okay.
and instantly the trigger started.
Okay.
So that doesn't mean we can't enjoy a little here and there, but by and large we moderate and take care of it, and use home cooked foods and taking care of the environmental surroundings. And other thing is, especially if the doctor has advised any kind of treatment,
Hmm.
wholeheartedly have the trust in the doctor and follow the plan.
Yes. Yes.
That is what I would suggest.
Okay. And for the viewers or maybe parents are watching this video, can you explain little bit more about the inhalers and the nebulizations, nebulizer, how we have to use for the child with
Yeah.
asthma?
Very young children, the pediatrician would give you a spacer because the child is not in a position to breathe in and breathe out. Always understand the technique of using the spacer and the bronchodilator. Take a few extra minutes, understand it from your pediatrician. And two categories exist. The Aslan type of inhalers are our rescue medicines,
Okay.
and the prevention or the inhalation steroids. With the steroids also there is a misnomer. People are worried. These steroids are not going to harm the development of the child. In fact, they will reduce the inflammation of the air passages at the quickest and keep the child comfortable, and quality of life is ensured.
Okay.
Yeah.
And ma'am, this asthma is curable or just manageable?
According to the medical parlance, with all the preventions, we can prevent it, keep it at bay. And if it is happening, then we are in a position to manage, taking all the precautions and the medicines prescribed by the doctor. Here, I would like to give a special input because I am deeply into healing the subconscious mind modalities, especially the communication and the general warmth and the cordiality in the house, the child feeling a safe space.
Okay.
And not only that, especially the anxiety of the parents. If the parents are positive and they receive it well and take care, the child responds differently.
Okay.
And taking care of the diet, especially the constipation. And I have even seen where, you know, we have placed affirmations. I am fit, I am fine. This also helps. And you'll be surprised, ma'am, the neurolinguistic programming techniques, very clearly we can remove the feeling from the child child's mind that I am unwell. You can actually remove it from the child's mind. And not only that, when you're giving what is known as the belief transfer technology of the neuro linguistic programming, the child believes I am fit,
Yes.
I am fine. The way this child is going to respond to
Hmm.
the sickness is totally different. I have many case studies from my clinic.
Okay, okay.
Yeah.
So thank you, ma'am. Thank you
Thank
for
you.
the valuable information.
Yeah.
And thank you, dear viewers.